the drugs, different category of drugs that is used in the treatment of psychosis. And based on the two categories, we are going to discuss about the pharmacological actions, mechanism of action, adverse effects of typical or conventional antipsychotic drugs, and the other one is atypical antipsychotic drugs. So coming to the introduction, the psychosis is nothing but a thought disorder where it is characterized by a disturbance of reality and perception. So the person will be different, they perceive the things in a different way, and there will be associated impaired cognitive functioning and then inappropriate or diminished affect, that is the mood. So basically it is a thought disorder where there will be an incoherent thought process, and then the perception, the way they perceive the surroundings will be different, and which is manifested by the symptoms like delusions, illusions and hallucinations. There are two types of psychosis. One is the organic psychosis and another one is the functional psychosis. The organic psychosis is nothing but where there will be some brain pathology. It may be a tumor or it may be due to some infections or disease, other things. So that is organic. Because of that, they can develop a psychosis. Whereas the functional one is there will be no brain pathology will not be there. So that is called the functional psychosis. So coming to the schizophrenia, which is a main important aspect in this particular topic, which is a functional psychosis in which there will be a personality changes will be there associated with thought disorders, but there is no evidence of organic cerebral damage. That is the main important thing. We cannot find any pathology there like a tumor or some infections or any disease like that. Okay, that is why it is called as a functional psychosis. And the positive symptoms, if you see, they have the delusions, illusions, and the most pathognomonic feature of the schizophrenia is auditory hallucinations. What do you mean by that? That means the patient will tell that some two persons are talking about me, but of course in reality the person will be talking something else. But this particular person who is affected with schizophrenia, he will think that those two persons are talking about me only. So which is a pathognomonic feature for schizophrenia, auditory hallucinations. There is one more category called visual hallucinations, which comes with a substance abuse. One of the important thing is lysergic acid diethylamide, which I will be coming into the later thing. Then there will be a thought disorder, stereotyped, or sometimes if it is severe, there will be a aggressive behavior as well. So these are the positive symptoms. What about the negative symptoms? They have poor socialization, they don't move well with the other people, so they behave as an introvert behavior, and there will be a lack of motivation and cognitive deficits. These are the negative symptoms. Why it is so important? Because the conventional or typical antipsychotic drugs, they relieve the positive symptoms only, but doesn't relieve the negative symptoms. Whereas the atypical antipsychotic drugs, the newer one like clozapine, olanzapine, those group of drugs, they cover both positive symptoms as well as the negative symptoms. So coming to the pathogenesis, so of course any disease they will have a pathology behind. So the common first thing is the genetic predisposition. Any disease, the genetic background will be there. So here also the monozygotic twins, they have a more 50% chance of getting this disease compared to the dizygotic twins. So there is a genetic predisposition is there, especially if you take in the populations like European populations, they have found out a particular gene, neuregulin 1, which may be responsible for this particular psychosis, especially the schizophrenia. The second hypothesis, which is very commonly accepted for a long time, is dopamine hypothesis. Nothing but excess of dopamine, whether it may be a receptor density may be more or the synthesis of dopamine may be more. So the dopamine excess is a culprit for the pathogenesis of this particular schizophrenia. How did they identify that? So they have done the post-mortem study. Based on the post-mortem study of both schizophrenic and non-schizophrenic patients, what they have found out is, in the schizophrenic patients, by doing the post-mortem of the brain, they found out more dopamine receptor densities present in the particular areas like limbic system, nigrostriatal areas, those things. And so that is why they are saying that excess dopamine is acting on the receptors to produce this disease. And then similarly, they also found out that they gave a dopamine agonist and drugs like L-Dopa, all those things when you give, that also is aggravating the symptoms and signs of schizophrenia. So based on these findings, they say come to a conclusion that dopamine excess is the culprit for this particular schizophrenia. Then after that, they developed drugs based on the dopamine antagonist by targeting the dopamine receptors, and that too they found out that dopamine D2, which is present in the mesolimbic and mesocortical pathway, which is responsible for the signs and symptoms. So they targeted the D2 receptors in that particular area. But of course, there are different D2 receptors are present in other places as well. Like I will tell you the pathways in the next slide, dopaminergic pathways. So like that, they found out that dopamine excess is the culprit. Then this dopaminergic drugs, the problem with that is they produce extrapyramidal symptoms, which I will come to the adverse effects later, and by blocking the D2 receptors. Then the theory came, the serotonergic hypothesis. Here also the hypothesis came based on the drug, as I said earlier, the LSD, lysergic acid diethylamide, which is a substance abuse drug. And the people who are using this LSD, they found out to be having the similar signs and symptoms like psychosis, and especially here the visual hallucination is more pathognomonic for this particular when people who are taking LSD. So what they found out is, when we target the serotonergic receptors, like giving an anti-drug that is blocking the serotonergic receptor, it is going to relieve the symptoms of schizophrenia. This is how the serotonergic theory came. So especially the 5-HT2 antagonist will be quite useful for this treating schizophrenia. Next comes the latest theory, was the glutamate hypothesis. Again, here also it is based on one particular drug called ketamine, which is mainly used as the intravenous general anesthetic. And if you give ketamine, some people they will have a psychosis type of symptoms with hallucination and other things. So what they thought is, actually ketamine is a NMDA antagonist. So when you give an NMDA antagonist, that is N-methyl D-aspartate antagonist, if you give, they will all produce a psychosis symptoms like hallucinations similar to the schizophrenia. So now what the theory says that if we give glutamate, it will be relieving the symptoms of schizophrenia. So these are the theories which has developed over a period of time, but today we are going to discuss about the dopamine antagonist, one particular drugs like typical or conventional antipsychotic drugs going to target this particular neurotransmitter, and then there is a atypical antipsychotic drugs is going to target the serotonergic hypothesis. And so far the drugs targeting the glutamate is not come out in the market. So coming to the main classification, first thing is classical or typical antipsychotic drugs. So there are different categories like chemical groups like phenothiazines, which is the most important one, and we have got under which we have got a 3 subcategories like aliphatic tertiary amine side chain. So the chlorpromazine, which is the prototype drug, the first drug came into the market under this category. And then piperidine moiety, the structure, the phenothiazine structure containing the piperidine moiety, examples thioridazine. And then the piperazine moiety, a third one is the trifluoperazine and flufenazine. So these are the 3 subcategories coming under phenothiazines. The next category is thioxanthines, which is the thiothixine and flupentixol are the 2 drugs available. And the third category is the butyrophenones. Here if you see, the most commonly used drug is haloperidol, and especially haloperidol can be given in the form of intravenous formulation and parenteral formulation, and droperidol can also be given. And there is one drug called domperidone, which is not commonly used in the antipsychotic drug because it is targeting the dopamine receptors present in the gut. It is mainly used as a antiemetic drugs, but it comes under the category of butyrophenones. So next thing is the miscellaneous drugs like loxapine, pimoside, sulpiride, amisulpiride is there, molindone. These are some of the newer drugs which fit into the category under the miscellaneous. And the second major category is the atypical antipsychotic drugs. The drugs like clozapine is a prototype which came first into the market, then followed by the olanzapine, quetiapine, risperidone, and the newer drugs like lurasidone, sertindole. These are all comes under the category of atypical antipsychotics. Why it is called atypical means it is deviated from the mechanism of action from the typical or conventional drugs. Like as I said, the typical drugs, they mainly block the D2 receptors, and these atypical drugs, they mainly target the serotonergic, especially the 5-HT2A receptor antagonist. So coming to the dopaminergic pathways, why these pathways is important? Because we have got the 5 pathways like nigrostriatal pathway, the mesolimbic mesocortical pathway, tubero-infundibular pathway, and medullary periventricular pathway, and inserto-hypothalamic pathway. The main thing is the first 3 pathways are very important. The last 2 pathways, it's not so important, and especially the 5th pathway, inserto-hypothalamic pathway, mainly they are responsible for the copulatory behavior in animals. So we are not bothered about this one, for the 5th pathway. Out of the first 3 pathways, the psychotic symptoms lies because of the excess dopaminergic receptors, especially the D2 receptors present in the mesolimbic mesocortical pathway. And if you see, the function of that is mainly it controls the behavior. So our drug should target the D2 receptors by blocking the D2 receptors in this pathway alone, that is the mesolimbic mesocortical pathway alone, so that the signs and symptoms of psychosis can be controlled. But what happens? Our drug cannot differentiate like that. So it also binds the typical or conventional antipsychotic drugs like chlorpromazine. They also binds to the D2 receptors present in the nigrostriatal pathway as well as the tubero-infundibular pathway, and because of that we get the undesirable adverse effects. Like for example, the nigrostriatal pathway controls the voluntary movements. So when you block this, your extrapyramidal symptoms will come. Like there are 6 symptoms and signs which I will discuss in the later slide. And similarly, the tubero-infundibular pathway is responsible for the prolactin release. So when you block the D2 receptors in this particular pathway, the prolactin will be increased. There will be increased secretion of the prolactin. And what about the prolactin? It is responsible for the lactation. So the person will have the gynecomastia, and then in females, if you see, it will be having amenorrhea due to excess prolactin. In males, there will be a gynecomastia and galactorrhea will come. So this is what the importance of the why the drugs blocking these other pathways leading to the adverse effect. So the main aim of our drug should target the mesolimbic mesocortical pathway, but since the drug cannot differentiate, they all bind to all the 3 pathways and target the D2 receptors. So this is the importance about the dopaminergic pathways. So if you see that the name itself suggests mesolimbic mesocortical. So from the cortex to limbic system, it gets connected, the neural tracts. Similarly, nigrostriatal pathway, the substantia nigra to the chora striatum. So the connections will be there. So unnecessarily the D2 receptors is present here, which is blocked by the drugs, conventional drugs. So the side effects like the voluntary movements will be disturbed. Similarly, the tubero-infundibular pathway, because of the prolactin increased release, galactorrhea, gynecomastia, amenorrhea, all those things will happen.